So at GripAble, we are developing the world's most efficient and effective patient rehabilitation pathway. We do this through a combination of software, sensors and online coaching, really allowing patients to transition their rehab from hospital into the home environment. GripAble's inspiration came out of my research whilst at Imperial College London. I was doing a PhD in neuroplasticity, looking at the biomarkers of assessment and also outcomes of rehabilitation, and how we could actually improve rehabilitation post-brain damage. At Imperial we had a lot of technology, a lot of robotics, but actually very few of those spun out of that research environment into the real world. And really, we wanted to do something that could get into the patient's hands, that could be at the bedside and that could go home with them. The NIHR has actually been quite a constant presence from my academic days through grant applications whilst in Imperial College, and then transitioning through to support of the company itself in partnerships and collaborations with Imperial and other universities. We've received a number of grants from the NIHR, and it's not just money, it's also the mentorship and support around the evidence base and the growing, which has been incredibly valuable. I4I funding allowed us to really pursue a channel of research for ourselves in peer-to-peer interaction of patients, so allowing patients to train with one another online. We know this is a huge driver of engagement. It allows patients not to just be scared by technology, but actually interact with people that they know are similar to themselves. And we know gamification in particular is a way of getting these people to engage with their rehab, but what a fantastic opportunity to build an online social platform, and that's really what the I4I grant funded. So GripAble raised Series A recently, just over £8 million. One of the biggest bits of advice I'd say, especially from that early stage funding through to now engaging with VCs, is to really not be afraid to hold back. Go big on vision, really actually sell something to those guys that they can buy into. However, you need to have the evidence and the core backing for those foundations to say, well, here's the proof of what we've done to date, and now give us the support, really, to take this on an international, global scale. Future of GripAble now is a transition from our first sensors deploying into hospitals, really into transforming a whole care pathway. We definitely came from the early days of where can we help that patient at the bedside, how can we get technology and gamification into their hands, and really now transitioning much more into, as I said, a whole new care pathway. How does that patient begin on their rehabilitation journey with us? How do we support them from the acute phase in the hospital bed through to their home environment, and not just have simple technologies in their hands, but actually allow the therapist to really engage with them moving forward and make sure their outcomes are as best as they possibly could be.